Everyone's back in school, and because strep throat doesn't take a holiday, let's talk about some of the most common strep throat questions we've been getting in the office this week. As everyone knows, strep throat is the scourge and plague of our kids when they are in any school setting, whether that's preschool or even our regular older school-age kids. And strep throat's pretty routine. We all know how to test for it. We all know how to treat it. But what happens when you start getting recurrences and multiple episodes of strep throat, and how to approach it and what to do about it? There are 5 main issues when it comes to a recurrent pattern of strep throat. First is, hey, your child wasn't able to complete the medicine or didn't adhere to the medication, which is not uncommon. We all have little kids, and a lot of them hate taking medicine. Ways to solve that are change to a different medicine we know treats strep that might taste better. We also have an injection, penicillin G. You do 1 shot. That's depending on the size of the shots, depending on how much your child weighs, and that treats it for the entire course, and you don't have to do anything else about it. So it hurts, but that's one way to make sure that non-adherence to medicine isn't a problem. Second is you took the medicine, you got better, but you're in a situation like a classroom where there is just re-exposure to the same or a new strain of strep throat. And that can occur seasonally just because there may be times where strep is really prevalent in a classroom or a preschool setting. Or you took the medicine and you just didn't get better because the medicine failed. That's usually because there is something in the bacteria that makes it resistant to the medicine you used. Some strep bacteria produce a substance that breaks down certain amoxicillin or penicillin components before it can actually treat the strep. So you have to switch medicine to a medicine that isn't susceptible to that. Fourth is that you could have gotten strep, taken all the medicine might have worked, but there is what we call a suppurative complication, meaning that the strep could have caused an abscess or a deeper infection in the soft tissue, in which case the oral medicine isn't enough, and that has to be assessed by your doctor. And the most confusing issue where this can come up is that a certain percentage of kids in any classroom or any group setting can become what we call strep carriers. A strep carrier is a common normal occurrence, especially in young children, after completing antibiotics, where the strep lives on your tonsils or in your throat. It's not making you sick. It isn't a higher risk for any issues or problems or complications. You're unlikely necessarily to pass it around in most cases, except in possibly very close household or close contact situations. But every time you get another infection that's usually a virus, you keep testing positive for strep and keep getting treated for it. So the carrier state is by far the most confusing and the most difficult and causes the most stress and anxiety, at least around the office. So how do you know if your kid's a carrier? One is that he keeps testing positive for strep even when he has a pretty normal exam and his symptoms are more viral. Things like with cough, runny nose, vomiting or diarrhea are things that seem unrelated to strep. And his physical exam doesn't fit the typical physical exam of an acute strep infection, meaning his throat and tonsils appear normal and not inflamed, even though he's testing positive for strep. You establish a carrier state by, after completing a course of antibiotics and having your child be completely well, you return to the office for a highly accurate strep test that can either be a PCR molecular test or a culture on a plate. Usually rapid strep tests are poor at assessing carrier states. So just so you know, as a parent, if you're concerned about this, the kind of test you should be asking for to make sure that you know if your kid's a carrier or not. If your kid is a carrier and tests positive when they're completely well and has a normal exam, they don't necessarily need to be treated for that, since carrier state isn't dangerous or concerning and will pass by itself. The only reason to treat a carrier would be if that there's multiple infections going on in a household or close contacts. So therefore you need to treat the carrier to stop those. And carrier states don't, like we said, have a very low rate of any problems for the actual patient and go away by them. If you know your child's a carrier and they become ill with viral symptoms or they're sick, how should your doctor approach it in terms of deciding whether to test and or treat for possible strep throat? The way we do it in our office is that there's a pretty accurate scoring system we can use on physical exam using a combination of symptoms, physical exam, and age to determine if this issue, this illness, is likely at high risk or unlikely low risk to be caused by strep, and then using that as a determination whether to test and treat in a kid that we know is a carrier. And once again, unless you're having problems, that is a pretty simple way of doing it and avoiding overuse of antibiotics and waiting for the carrier state to pass on its own, which it will often do. I hope this helps some of our strep throat issues that we're seeing this fall. Everyone should have a really healthy school year.